everyone, I hope this message finds you well. I understand these are not the ideal circumstances for this sort of learning, but I'm glad to know that students are back on campus even if it's mostly spiritually and virtually instead of physically. My name is Elizabeth Gandara. I am the Alcohol, Tobacco, and Other Drug Health Educator with Health Promotion and Wellness here at SF State. I really like my job because I get to have conversations with students around the safer use of alcohol and drugs. I have provided my work email along with my number so y'all can reach me with any questions you may have that are not covered in this video. In this video, you will learn some safer use guidelines for alcohol consumption. You will also learn the serving size of alcohol, the most commonly used substances for college-age students, along with safer use practices for those drugs, and finally cover the levels of substance use and do a self-reflection of when substances may be having an impact on our professional, personal, and academic goals. When we discuss protective behaviors today, we are referring to activities that someone can take while using substances to avoid hangovers or other adverse consequences that occur as a result of substance use. The average someone drinks alcohol for the first time is around 14 years of age. Many students go to college already having their first experiences with alcohol and other substances, although there isn't much health education around it. At HPW, we do not focus on abstaining from substances, but rather we prepare any student with the knowledge they need to make the most informed decisions for themselves or others around substances. So, what are the good and not so good effects of alcohol? Some may say that it makes them feel relaxed. It helps them unwind after a long day, feel more confident, and allows for easier and more comfortable time when socializing. Some may describe the not so good drawbacks of alcohol to be how expensive it is, how dehydrating it might be, so like waking up the next morning feeling so dehydrated, right? Impairs their judgment, leading them to enact behaviors they later regret, and it makes some people vomit, causes headaches, makes it difficult for some to breathe, and causes unconsciousness and blackouts when someone drinks way too much. This would be considered alcohol poisoning as well. Avoid the undesirable effects of alcohol by sticking to 1 to 2 standard alcoholic drinks per hour. One serving size of alcohol depends on the type of alcohol and the percent of alcohol content in it. A White Claw, for example, is 5% alcohol content. Therefore, 12 ounces would be equal to 1 serving size or 1 drink. Wine has about 12% alcohol content. Therefore, 5 ounces would be considered 1 drink. Tequila, vodka, or cognac has 40% alcohol, and therefore 1.5 ounce is considered 1 drink. 1 shot of tequila would give you the same effect as 5 ounces of wine. However, it is very easy to overdrink liquor and forget how many drinks you have had, and therefore many individuals can experience alcohol poisoning. It is important to follow safer use protective tips to avoid a hangover, or worse, to end up in a hospital with an IV in your arm because of dehydration or alcohol poisoning. First of all, pace yourself when you are drinking. If it's your first time, stick to 1 drink per hour and notice the effects that take place in your body. It is recommended that people stick to 1 or 2 drinks per hour. It is also very important to drink a glass of water after every drink to help pace oneself and also just to stay hydrated. It can be helpful to start drinking plenty of water in the morning and afternoon, proceeding to starting to drink. This can be a major game changer to avoid those gnarly symptoms that usually occur when hangover. Drinking coconut water or other electrolyte-rich drinks is also a really good idea. Check in with your friends before you start drinking and ask yourself, what kind of night do y'all want to have? Do you want to remember everything that you experienced that night, or do you want to have a chill night without a hangover the next day? If so, then you can indicate how many drinks you'll have and just stick to them. Avoid mixing alcohol and drugs, as some drugs can have very harmful reactions with alcohol. The food we eat is also just as important to how our body interacts with alcohol and other substances. So make sure that you eat food with lots of whole grains, carbs, and protein in them. So, what foods should you eat and which should you avoid? Eggs, Greek yogurt, chicken, salmon, and other proteins are very helpful in keeping us full and delaying alcohol absorption. Oats are also a great source of both fiber and protein, which is also helpful for liver health and the slowing down of the alcohol absorption. Avoid spicy foods like hot Cheetos and salsas before drinking, as they can trigger acid reflux. Salty foods can make us feel bloated, and refined carbs and sugary foods are processed much quicker and therefore won't help us as much in delaying alcohol absorption. However, any food in the system can help, so never starve before drinking because you will regret it the next morning. How do you know when something is wrong? Whether you have had your first experiences with alcohol or not, trust your intuition. If you are around someone who might have been drinking and is not breathing normally, is cool and clammy to the touch, unconscious, or not waking up after you've tried getting their attention, something is probably wrong. Vomiting is a more obvious impact that the individual might have alcohol poisoning. Multiple symptoms and unconsciousness might require medical professionals. If an individual is experiencing the following, be sure to lay them down on their side and not their back. People can unconsciously choke on their own vomit and stop breathing. Be sure to call 911 or the University Police Department if you are ever around anyone who is experiencing alcohol poisoning or any of those symptoms. So what happens when you're at a house party or kickback and a friend you just met is in and out of consciousness from alcohol? First of all, let's acknowledge that going to a house party or hanging out with people outside of our home is probably not the best idea right now due to the coronavirus. But let's say hypothetically, do you avoid the situation, hope someone else helps them out, or do you actively intervene to ensure that the individual makes it home safely or gets the help that they need? Oftentimes, people think that it's not their business to intervene in these sorts of situations. However, it is much better to ensure the safety of someone than to take a chance. There are a variety of ways in which we can actively intervene in this kind of situation. We call them the 3 Ds of bystander intervention. Number 1 is distract. To distract someone who might have malicious intent with your acquaintance, you can spill a drink on them or ask them to help you with a task that requires them to step away from the individual. Number 2, delegation. It requires you to find someone who has power and control in that situation. Maybe the house owner can help you take ownership over ensuring this individual gets home safely. Call their emergency contact and let them handle the situation. If they are inebriated to the point of unconsciousness, call the paramedics. Number 3 is direct. Try to get the attention of the unconscious individual to see if they're okay. If they are in and out of consciousness or falling asleep, stay with them until you can find their friends. Make sure they take their friend home and recommend that they lay them on their side to avoid choking during sleep. It is not easy to intervene. It can be awkward and more work than you might have bargained for that night, but it is essential to ensure that people feel safe and that harm is avoided or reduced. Although this is totally self-paced, I have a question. How do you party responsibly? Now that you know the basics on safer use of alcohol consumption, let me know what you are thinking. Follow this QR code by taking your phone camera out and pointing it towards the code. A link should pop up at the top and you can press it and follow it to the Padlet board. If that doesn't work for you, just follow the link below. Fill out the prompts. I would like to know how you plan to modify or continue to practice safer alcohol use. If you don't drink, let me know how you plan to intervene amongst your peers to ensure the safety of any vulnerable individuals. I want to quickly discuss the steps to throwing a safe and responsible party. If you are ever in the position where you or your housemates throw a party, these guidelines could aid in preventing many people from getting a hangover the next day. If you have the option of serving food, offer foods high in protein, such as granola bars, dino nuggets, and other easy to hand out prepackaged or prepared food. Offer non-alcoholic drinks for designated drivers and for people to alternate with throughout the night. Make sure that there is access to water and that there are closed or sealed water bottles nearby that people have access to. Measure drinks for your guests. Make sure that the drinks they are having are standard drinks. Drinks like jungle juice make it really hard to know how much alcohol is actually in a serving. Never ever force guests to drink. Shift the peer pressure culture and allow people the autonomy to choose if they are ready to drink or not. And finally, try to stop serving alcohol an hour before the party ends to allow people to sober up a bit before they take off. Now I'm going to quickly cover the most commonly used recreational drugs amongst college students. There are many drug categories, but today we're going to discuss stimulants, depressants, prescription opioids, and hallucinogens. Stimulants are also known as uppers, which provide a euphoric and calming sensation, along with elevated mood as a result of an overabundance of dopamine levels within the brain. Stimulant drugs are those like cocaine, Adderall, and even caffeine. Depressants are drugs that slow down the brain function. They can calm nerves, relax tense muscles, and help treat conditions like insomnia, anxiety, or muscle spasms. Opium-related painkillers, or opioids for short, include drugs like Vicodin, oxycodone, and codeine, and are very powerful drugs that interfere with the nervous system transmission of the nerve signals that allow us to perceive pain. They react on the nervous system in the same way drugs derived from the opium poppy like heroin do. Opioid-related painkillers are highly addictive, and past overprescribing and regulation of prescription has led to former pain patients relying on street drugs like heroin and meth. Lastly, hallucinogens are drugs such as LSD, acid, and magic mushrooms, which generally cause a person to see images, hear sounds, and feel sensations that seem real but don't really exist. Cannabis is the plant that marijuana comes from, and it has a plethora of uses, from clothes to lotions to recreational use and medicinal purposes. Marijuana refers to the part of the cannabis plant that contains tetrahydrocannabinol, more easily known as THC. THC is a substance responsible for the effects of marijuana. Some safer use strategies for marijuana would be to avoid driving until the effects have worn off, usually 1 to 6 hours after consumption, depending on the method of utilization and individual tolerance. It can impair motor functions. Another strategy is to avoid using it if you are predisposed to conditions like schizophrenia or psychosis. If you are unsure and are trying it for the first time, be around people that you trust and that know who to contact if things go south. If you are consuming it through an edible, be sure you purchase it from a reliable shop to be sure that you are not over-consuming THC. Take a bite at a time and avoid eating the whole thing in one sitting. The effects can take up to half an hour to an hour to peak, so take it slow and be patient. And finally, since we are still in a pandemic and COVID is still very prevalent, don't share your blunt, bong, or vape with anyone. Now we're going to discuss cocaine, which is a stimulant drug. Cocaine causes a short, intense high that is followed by potential depression and a craving for more of the drug. Since it is a stimulant drug, it makes it difficult for people who use habitually to sleep properly. Some safer use strategies for cocaine include alternating nostrils after use if it's being snorted, and to avoid mixing with alcohol or drugs. Alcohol is a depressant and naturally makes people sleepy. Some might have a desire for increased energy and therefore use cocaine for the stimulating effects, continuing to drink thereafter. What they don't realize is that the stimulating effects of cocaine make the brain believe that you have energy, when in fact the drowsiness you feel from alcohol is a sign to your body that you should stop drinking. Ecstasy and Molly can both act as stimulants and hallucinogens and vary from type. The effects of ecstasy and Molly come from the component MDMA. It is known as a rave drug due to its very popular use with raves, music festivals, and parties amongst teens and young adults. It enhances the user's pleasure center and levels of dopamine, leading to a depreciated amount of dopamine later on and increasing the desire to take more. Some of the effects it can have are nausea, muscle cramping, and involuntary teeth clenching, blurred vision, chills, sweating as well. The effects can last anywhere from 3 to 6 hours, and over the course of a week, one might feel irritability, aggression, impulsiveness, sleep problems, depression, and anxiety. Since MDMA can cause heart rate to increase and body temperature to rise, it is important to stay hydrated and drink plenty of water and electrolytes. Chewing gum helps prevent and counteract jaw clenching. It is important not to use alone and to have people you trust around you who can help you in case of an emergency or if you have a bad trip. Finally, I want to briefly discuss the levels of substance use. When we look at substance use through a harm reduction approach, we acknowledge that drugs are going to be used regardless of prevention efforts and education. Therefore, we hope to bring awareness to the effects and the safer use strategies to empower our gators to make the safest decisions around use for themselves. However, it is important to also acknowledge that there are various levels of substance use. Many people can balance their use with their professional, academic, and personal lives, while others may lose friendships and strain relationships with family and work goals over the effects of use. These guidelines below are used by the American Psychiatric Association to determine the levels of substance use from no disorder to mild, moderate, and severe use disorders. As noted on the slide, fewer than 2 of the above symptoms would not indicate a disorder, while 2 to 3 would be a mild disorder, 4 to 5 a moderate, and 6 or more a severe disorder and potentially addiction. It is important to note that there are different levels of concern for any of the above mentioned categories, and that they are ever changing as time passes. So just because some of those may have applied to someone in the past does not mean that they are currently experiencing them. If you would like to reflect on your own use, take the Alcohol E-Checkup self-assessment on the CAPS website provided in the link below. You may also schedule a meeting with our substance use counselor, Carla, with Counseling and Psychological Services. If you would like to chat more about substance use in general and would like a peer-to-peer or a health educator to discuss a specific topic further, please reach out to me and we can set something up for individual groups. Substance use may not be an issue for everyone, but it's important to realize when it may be impacting our personal goals and lives, our relationships, our work, opportunities, and our grades. This may show up for us in a variety of ways, from partying too hard the night before and missing class or assignment due dates. Isolated events are not bad, but when it becomes a habit, it may be time to analyze and reflect on whether your current use is impacting your opportunities. It is also important to reflect when we are simply using alcohol and other drugs as a coping mechanism to alleviate emotional and mental harm from our everyday stressful lives. Lastly, we are still in a pandemic, and the rates of transmission within young adults has steadily increased in the United States, in the Bay Area, and in many other parts of California. It's important to minimize physical socializing as much as possible. If it becomes too difficult and you happen to find yourself at a physical gathering, be sure to wear a mask at all times and avoid sharing any food, drinks, or objects with others who do not live with you. Wipe down any items that may have been touched with disinfectant and avoid large gatherings and being outdoors around others for elongated periods of time. That is all for this video, but please be sure to visit our website wellness.sfsu.edu for events, workshop requests, and resources in sexual health, men's health, nutrition, basic needs, substance use, mental health, and much more. Also, please follow us on Instagram or Twitter. Our username is sfstatecares. We post about the latest events, educational posts, and campus resources. If you have any questions, please email me at egandara@sfsu.edu or text my work number 650-535-0059. Hope y'all are well and can't wait to see y'all on campus again someday.